My last video was on December 27th, telling you that I had the best presence of 2025, a solution to the biggest challenges facing society. That was before the healthcare crisis hit. And now everyone's prices are skyrocketing. And now there's going to be a cascade of really negative events on the way. And to top it all off, there's a shutdown on the horizon, January 31st. Well, fortunately, nothing's as bad as it seems. Now that Mamdani's vision is catching on, I'm happy to lend our support to him any way he needs, because PHIERS.org can pay for his entire agenda. That's what I have to offer. A solution to some of the biggest problems that he campaigned on that will allow his platform to be embraced nationwide. Because it'll even help people who need affordable health care, affordable rent, public transportation, lower food costs. I mean, we've got to focus on more than just rent stabilization. We need to be buying and renovating buildings. So I'm going to tell you what I'm going to tell you, I'm going to tell you, and then I'm going to tell you what I told you. I'm going to tell you how we can pay for Zor Mamdani's entire agenda so he can be successful quickly. Then I'm going to tell you how we can reduce the cost of medications and health insurance enough to make universal coverage a reality. It'll be sustainable because it pays for itself out of savings without increasing taxes, raising the deficit, or requiring legislation. So, and hold Congress accountable for allowing this type of health insurance plan to be available on Obamacare exchanges. It's called telehealth. It costs $50 a month, $600 a year. And the only thing that's different between it and a traditional insurance plans, whether you're talking about private insurance or Medicare and Medicaid, those plans cost like $8,000 a year because they include hospitalization and specialty care like dialysis. But most people don't need that, and they'll be just fine with the $600 plan. So if we hold Congress accountable for letting telemedicine be a part of the Obamacare exchange, then they people into $600 as opposed to $8,000 a year plans. You know, that's going to leave $7,400 to invest in getting more people to move from traditional insurance to telemedicine. We will literally be saving trillions every year if we do that and buy our medications through not-for-profit prescription drug companies like Mark Cuban's Cost Plus Drug Company, which doesn't have a profit motive. Now remember, the U.S. imports 90% of its medications from countries around the world. And it's done with huge markups and middlemen, which is why medications cost so much. Well, because we're inviting everyone who thinks Trump's policies are bad to buy as a group through the fire sale marketplace without markups or middlemen, we'll generate enough savings to make universal coverage a reality. We'll be the biggest purchaser of medications in the nation, generating trillions in savings every year. That will allow us to sponsor the placement of anyone who joins into whatever telehealth platform they choose. Zor is what I'm familiar with. They're pretty good. The telemedicine platform is something that I documented well over a decade ago, exactly what they're doing today. Just like Mark Cuban's drug company, not-for-profit manufacturing and distribution, Al Wilson was president of SureSafe Farmers, which was formed in 2007. He and I got together in 2009 for the nonprofit that I was a founder of. PHIERS.org. They would sell medications to people who had chronic diseases to reduce the cost to Medicare and Medicaid. The problem is the Panama Free Trade Agreement wasn't implemented until 2012, and that's 3 years that we had to figure out how to survive, so we pivoted. So from my perspective, the free trade agreement failed because SureSafe never launched. And what I'm trying to do for Mark Cuban is exactly what we wanted to do with Al Wilson and SureSafe. And that's been documented for over a decade. We're ahead of our time. When we hold Congress accountable for allowing telemedicine in the Obamacare exchange, the moment that happens, we generate enough savings to give you monthly checks to pay for public transportation, public grocery stores, everything needed to make Zor Mamdani successful. PHIERS.org. My plan will reduce medication costs. It will reduce insurance costs because it will make universal coverage free. You can learn more about it by visiting my website, PHIERS.org, PHIERS.org. It's an acronym for the People's Health Insurance Endowment and Referral Service, because to us, healthcare is a human right. And it'll fix healthcare in time for Congress to avoid a shutdown. And I'm proud to say that Senator Chris Van Hollen wrote a letter of support for us 11 years ago because he knew that we were the right thing at the right time. The problem is I had to solve other problems too. So I wasn't able to launch then the way that I wanted to. But everything Chris Van Hollen thought we'd do, we can do it now. My plan will get the profit motive out of healthcare. It will generate trillions in savings so we can give people monthly checks to deal with inflation, so we can fix a lot of the problems caused by Project 2025 and Doge. Yes, we've got to rebuild, and my plan will get everyone on the same platform so that we have a smaller, smarter government that uses shared services to address the needs of we the people in ways that can be trusted. Learn more at PHIERS.org. Catalyst for positive change. Together, we can make America better and healthier. MABAH. MABA. Sounds like MAGA, but it's a lot better.